Perfect, perfect. And just start off by saying hello, everybody, and thank you so much for coming tonight. For those of you just sort of coming in, we would love to hear. I mean, I know you've already said, Heidi, that you're coming in from Lake Tahoe, but I'd love for you guys to just use the chat to say hello and to say where you're dialing in from. We've had registrations from as far away as Australia and Argentina. So yeah, it's very interesting. I'd love to hear where you're all coming in from. And once again, this is right now being recorded, and everybody who has registered will definitely receive the recording. And I think Barbara and I have even talked about putting it on YouTube channels and things like that. So yeah, you can catch us. You can always catch some more information on there. So if you are as you're going to be receiving the recording, rather, you don't have to worry about taking notes or pictures of the screens or anything like that. You can just be with us here, be present, be in community with us. That would be lovely. So for the first few minutes, it's just going to be logistics and disclaimers. So hopefully that'll give some more time for latecomers to come in and give everybody a bit of more of a chance to settle in. I'm going to start sharing my screen. Where's my presentation? There it is. Slideshow. Okay. Now I'm gonna just put down all the faces so you don't have to see you don't have to see everybody's face while the recording is going. So just a very quick disclaimer. All the information in this presentation is provided as an information resource only, and it's not to be used or relied on for any diagnostic or treatment purposes. This information does not create any patient-physician relationship and should not be used as a substitute for professional diagnosis and treatment. Please, pretty please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. Thrive Nutrition Practice, which is me, and Redbird expressly disclaim responsibility and shall have no liability for any damages, loss, injury, or liability whatsoever suffered as a result of your reliance on the information contained in this presentation. And by enrolling and attending this workshop, you agree to these terms and conditions. And if you do not agree, you are kindly advised to leave the workshop, but I sincerely hope you stay. All right. Now that we got all that boring stuff out of the way, if I could just change my screen. There we go. Let me formally introduce myself. Many of you know me already, but my name is Cristina Tahoces. I'm a holistic nutritionist and the owner of Thrive Nutrition Practice. I help women thrive, not just survive, by personalizing nutritional plans for them based on their blood work, their medical history, their symptoms, and their lifestyle. Right now, I am 49 years old and in the throes of menopause myself. I am married and a mom of two teenage girls, so my house is like one big hormonal cocktail. I'm also lucky to still have both of my parents with me, and so I'm part of that, sandwich generation who cares for kids and parents and somehow has to find enough time for self-care. But that's why doing these workshops is really important to me. I really believe that self-care starts with educating ourselves so that we can advocate for our own health and have better, fuller conversations with our healthcare providers. So thank you so much for taking the time to be here today and to practice self-care for yourself. The info that I'm going to be sharing with you is really the result of years of study and research and clinical experience with clients, and it's really helped me transform my own wellness and that of my clients. So I'm excited to be sharing this information with you. Barbara, would you like to introduce yourself?
Thanks, Cristina. It's great to be here, and I am here really out of such admiration for the work you do and the wisdom you bring, Christina, about this stuff. I am clinical director of Red Bird Therapy, which provides psychotherapy and coaching. We have a team of trauma-informed therapists, and we do a lot of work around mood disorders, so anxiety, depression, addictions, obviously trauma work, grief and bereavement, parenting. Many of you might be in that position, LGBT folks, and settlement. So we have a fairly diverse team of clinicians, and we're all registered psychotherapists. And me personally, I'm 57 and might top out on the age here. Who knows? I might go to competition to see who's oldest, but and I actually went through menopause in my mid-40s, quite surprisingly, quite young. And that was, for somebody who was pretty fit and everything seemed to be working a-okay, shook me up a little. So I'm really glad to be learning with you.
Mm-hmm. Just another really quick note. I'm working off one screen, and if I bring up the chat, you probably won't see a lot of my screen. So, of course, questions are always welcome, but I just ask you to maybe not put them in the chat, so because I probably won't be able to see them straight away. And if you could save them to the end, that would be amazing. Okay, so why are we here? Why do we even need to understand our blood work, right? Like, don't we have medical professionals for that? Barbara and I were really talking about perimenopause and the changes we go through as women. And we realized that both in our own way, we are trying to help women answer some very similar questions, like, is there something wrong with me? Why do I feel the way that I do? And I'm trying to feel better. I'm trying all the usual things that used to help me, but they're not helping me anymore. I don't understand what's going on with me. Do these questions resonate with you? Because I hear them a lot. And again, I'll check in the chat later, but if that's resonating with you, we'd love to hear it. Part of why we're here is to sort of be in this community together. So definitely, feel free to share in the chat if that's how you're feeling. The reality is that answering these questions is not really that straightforward. 57% of women report being misdiagnosed by their doctors. And if you're a minority, that number definitely goes up. Many women don't have a family doctor that they see on a regular basis. And if they do, they report a decline in trust. And I think there are many reasons for that, but I also think it's the result of a whole lifetime of being gaslighted. And I think Dr. Mosconi nails it with that quote there. Women have been taught to fear their hormones and doubt their brains. When we are teens and we get our period and it's painful and we cry and we lash out, despite ourselves, we hear that's, gosh, are you getting your period? Is it that time of the month? Like it used to be called the curse, right? And the only thing that we're or one of the only things that were recommended to sort of ease that discomfort is the birth control pill. And when we've had babies and we're feeling anxious to our core and we're getting sick all the time and we don't recognize ourselves in the mirror and we're having baby brain, we're told that this is life with young kids and there's nothing that we can do about it. We're changing. We will never go back to the way we are. And so then we reach menopause or we reach perimenopause. And the message really at that point is like, it's your hormones, they're changing, there's nothing really you can do about it. And so that together with the fact that we really only have 7 minutes with our doctor, barely enough time to be seen or heard. It's real. And, not to forget, of course, that they are also themselves, burnt out. And so very difficult to, display empathy when you yourself are burnt out. It's no surprise that I often hear things like, they just don't listen. He's just so old school. All they want to do is medicate me. And it's no surprise that we get to our 40s and 50s and we don't know where to turn to for help, or even if it's worth our effort. If you've been hearing your whole life that there isn't much you can do about these, hormones that are essentially uncontrollable, then they're really, we start to question really whether there is any return on investment on the time we take for self-care, right? And the fact of the matter is none of us have much time to waste. So maybe this question, that we have of like, we also start to think like, is this all in our heads? Is how we're feeling all in our heads? Maybe, this is how I feel today, but tomorrow will be different. But I think, back to the question of why are we here? I think if you are here, that there is a part of you that deep down inside knows that you want to live, that you don't want to live this way, right? That you want to thrive, that you want to transition out of fear and into thriving. And so today's workshop is designed, first of all, in the recognition that we are whole human beings with a mind and a body and a heart, and that all of this works together. Mental and physical health are one. And so this workshop aims to give us some of the information and the language to understand our mind-body dynamics during perimenopause better, so that we can use this understanding to stop doubting ourselves and to move into thriving. And as a mom of two girls who are just starting their hormonal journey, and as a caregiver for my folks as well, I personally feel like I need this language to advocate not just for myself, but for them as well. Okay, so what are we going to go through today? First of all, we are going to learn what are the blood markers that we should track over the course of our life. Our changing hormones certainly impact our health, and more specifically, our metabolic health. Generally speaking, metabolic health is a term that we use to describe how well we generate and process energy in the body. The better our metabolic health, the better our energy, the better our immunity, the less fat we store, the stronger our foundation for our mental health, and the lower our risk of disease. Our metabolic health is truly foundational to both our physical and our mental health. So if we are looking for clues as to why we are feeling low on energy, why we are anxious, why we can't sleep, why we can't seem to lose weight no matter how hard we try, if we are looking for a way to understand how our mind and our body, and therefore our health, is changing during the perimenopausal years, a good place to start is with a basic metabolic panel, just to understand where we're at and rule out any issues. So we're going to have a look at what a metabolic panel looks like, and also talk about how our changing hormones during menopause impact a lot of these key markers. Next, we're going to have a look at optimal ranges for those key markers. And as part of that, I'll take you through a little case study to show you why knowing your optimal ranges is so important, and how a personalized nutritional plan can impact your overall health. Finally, I'm going to turn it over to Barbara for her clinical pearls and her wisdom on perimenopause and menopause and our mental health. And then we'll open it up to Q&A. How does that sound for everybody? Thumbs up, I hope. Okay. All right. So let's start with the basics. Now, each time we go to the doctor, they may requisition different blood work depending on the symptoms and complaints we go in with. But getting a panel like this that includes all of these markers to assess your metabolic health on an annual basis is something that I highly recommend. Personally, as a nutritionist, a metabolic panel is extremely useful, as it gives me information on how effectively you use food to make energy. It tells me about your detoxification capabilities, as well as where we can start to address hidden sources of inflammation and potentially any immune issues. All of these issues are crucial for the perimenopausal woman and the menopausal woman, as many of the most common complaints at this age are lack of energy, sleep issues, and weight gain that is difficult to lose. All these factors also contribute to women feeling less confident about themselves, more anxious, more pessimistic, and less motivated. So the mind-body connection during these years is really very, very much there, right? And a common base for all of these mind-body issues is our metabolic health. These are the markers that I recommend you test every year. And I've grouped them according to the kind of information they can tell us. Of course, there is crossover. Our whole body is connected. So, some of the ones that you find under one heading definitely, in fact, they all kind of impact each other, I would say. And I also want to stress that it's not an exhaustive list. So if your annual blood work includes other markers, that's fantastic. Maybe some of you already have some kind of pre-existing condition and you need a more thorough panel somewhere. Fantastic. But these 26 markers are a really, really good place to start. The other reason I recommend getting a metabolic panel done annually is because after years of reading and researching in clinical practice as a nutritionist, I am thoroughly convinced that protecting our metabolic health is the key to thriving and not just surviving well into our golden years. And I'm not the only one who thinks so. Doctors like Dr. Lisa Mosconi, Dr. Peter Attia, Dr. Mark Hyman, Dr. Gabrielle Lyon are all sharing the latest research on how metabolic health is absolutely key. For women, our top killers are cardiovascular disease, Alzheimer's, and cancer. And all of these diseases have a metabolic component to them. Personally speaking, I can tell you my genetics predisposed me to type 2 diabetes and to Alzheimer's. And so I am very much personally invested in knowing and doing everything I can to protect my metabolic health. And I use these evidence-based markers and tools with my clients daily with much success, I'm glad to say. Okay, so I want to quickly go through these markers together just so that you understand what they are. First, we have our markers for immune function and energy, and we start there with a complete blood count. And a CBC for short is a mainstay of most blood panels because it is so central to your body's immune function and energy capabilities through basically what's going on with your white blood cell count and your red blood cells. Super, super important. So if you're chronically fatigued, for example, or you're fighting a viral infection, it's very likely that this is going to show up in your complete blood count. Also super important to your immunity and your mental health are your vitamin D levels. You've probably all heard of SAD or the winter blues. Vitamin D deficiency can impact everything from how well you are able to fight off, the winter viruses to how optimistic you feel in the darkness of February. Most people in Canada are deficient. So it's really important to get this level tested, especially if you are feeling chronically fatigued, chronically sick, or you feel sad all the time and you don't know why. Unfortunately, in Ontario, vitamin D is not included in your free blood panel that you're entitled to, but it's not too expensive to add on. I think it's about $30. One of the most important markers to track as you age, especially in your perimenopausal years, is fasting glucose. And ladies, when your doctor ticks off the boxes in your requisition panel, they can mark it one of two ways. They can ask for a fasted blood panel, or they can ask for a random blood panel. Please ensure that you get a fasted glucose reading at least once a year. Okay, I'm just going to say this again because it's really important. Your doctor can tick off random or fasted for the blood panel. Please make sure that at least once a year you get a fasted glucose reading. This is super important. Sometimes it doesn't matter. Like if you're going into your doctor multiple times a year with other complaints, it doesn't matter if you're getting it fasted or random. But when you want to understand your metabolism, when you want to understand how your body is using food to create energy, and if you want to answer questions about stubborn weight loss, chronic energy slumps, anxiety levels, joint pain, your fasting glucose level is extremely important data. In fact, I would say that it is one of the top data points you should know about yourself and track as you age. It relates directly to your risk for type 2 diabetes, cardiovascular disease, Alzheimer's, and other inflammatory diseases. Your HbA1c, that's related to your blood sugar. It measures your average blood sugar over the last 3 months, and it's what doctors use to diagnose prediabetes and type 2 diabetes. So very important. Iron and ferritin levels also speak to your energy levels, and they're tied to your thyroid health. I like to look at these together. And I often see this on the low side for perimenopausal women. Calcium, potassium, sodium, calcium, for example, it's one of the body's most important minerals, and it's essential for proper functioning of your nerves, your muscles, and your heart. Sodium, potassium, alongside all of the other minerals, they also control the amount of fluids and the balance of sort of acids and bases in your body. Total protein, one of those markers that can alert us to other problems in the kidneys or the liver. I mean, in conjunction, like if, for example, you suffer from swollen ankles, we really want to know what your total protein, calcium, potassium, where your minerals are at. That's really important. This all ties to kidney and your liver function, which is super important to assess for me because it's really crucial to your detoxification. And if we are impaired here in any way, then serious disease and illness can ensue more easily. And these markers are really telling with respect to your detoxification function. And of course, it's super important to understand what your thyroid is up to. Most doctors will only measure TSH, or your thyroid stimulating hormone, in the first instance. And then if there's a problem, they move on to getting a full thyroid panel, which is why those other markers there are asterisked. But we're going to talk about why thyroid issues go so underdiagnosed and why it's important to know your optimal levels. As we age, we also have to keep an eye out on our heart health. And that's why tracking your cholesterol is so important. Together with that, it's also important to see where your C-reactive protein levels at. And that's a measure of inflammation in the body, but more importantly, it speaks to your cardiovascular risk. Cardiovascular disease is the #1 cause of death for women. So this data is really crucial for all of us. So as I mentioned, these are not exhaustive. This is not an exhaustive list of markers. It is really just a starting point for a meaningful conversation about your health with your doctor, with your naturopathic physician, with your nutritionist, or other trusted practitioner who you speak to about your health. It provides information and data points on your immunity, your energy capabilities, how effectively you're using food for energy, how effectively you're able to detox, and where your cardiovascular health is at. Moreover, if you are experiencing symptoms like burnout, chronic fatigue, sleep issues, mood disorders, anxiety, if you are still having your period and they're heavy and painful, if you're suffering from adult acne, if you are unable to lose weight, basically any symptom that you have, running a metabolic panel like this can provide some real insights into how your health practitioners can support you. For a doctor or for a naturopathic physician, it can help them diagnose a condition that needs treatment. And as a nutritionist, I don't diagnose or treat diseases, but it can help me understand how to personalize your diet and supplementation protocol in order to target and support you in the best way possible. Okay. All right. Now, I usually recommend doing this kind of panel annually because the hormonal changes that we go through during perimenopause can impact your metabolic health. As we go through perimenopause, what happens is that our hormone levels start to decline. Our estrogen levels decline, and estrogen plays a very protective role in our metabolic health. It helps us stay insulin sensitive, for example. And when we are insulin sensitive, it is much easier to maintain a healthy weight. And our memory is better. Estrogen also helps keep our bones strong. It helps us flush out uric acid. It truly is one of those hormones of youth. But progesterone also declines, unfortunately. And progesterone is our chillax hormone. It helps us stay calm. So if you, like me, sometimes feel like that last week before your period is coming on, that you are like the picture of empathy one moment and then you like totally lose your cool the next. This, my lovely people, could very well be your progesterone levels leaving you in the lurch. And so it stands to reason that when these hormone levels start to decline, it will impact your health, and we will see that impact manifest in our metabolic health as an upward trend in these markers: fasting glucose, HbA1c, TSH, cholesterol, our inflammation marker, C-reactive protein, and also uric acid. The fasting glucose and the HbA1c marker is really my favorite marker to pay attention to because it plays a role in everything. It speaks to our ability to maintain a healthy weight, to create abundant energy, and ward off those like post-lunch slumps. It helps us ward off colds and keep our immunity strong. And it decreases the risk of major disease like gout, type 2 diabetes, cardiovascular disease, and Alzheimer's. And I just want to pause for a moment on the issue of cognitive decline and memory loss. Dr. Lisa Mosconi, she's written this book called The XX Brain. If you haven't read it, please do. She details in it exactly how menopause impacts our memory. I'm not going to do it justice because there's a lot of science behind this, but basically the decline in estrogen makes us less insulin sensitive and our blood sugar goes up. And she shows us really in no uncertain terms that this is exactly the reason why more women have Alzheimer's than men. It has nothing to do with the fact that we live longer. It has to do with menopause and the changes in estrogen, blood sugar, and insulin and how that affects us. The issue of memory loss is extremely important to all of us. We, for the perimenopausal woman, I mean, myself included, we start forgetting words. And here's the thing, when we can't rely on our brain power, we start to doubt ourselves even more than usual. And when we doubt ourselves, we also then stop advocating for ourselves, or we start advocating for ourselves less and less. So this is really, really important. And for those of you with moms still in your life, it's also really relevant to them. I went to the doctor with my mom last year, and her HbA1c was at 5.6. We will see in a moment that while that is not considered pre-diabetic, and doctor will never flag that, it is far away from what optimally it should be. My mother's mom, so my grandma, and all of her aunts had Alzheimer's. And so for me, seeing that number was a big red flag. And I sat my mom down and I told her she needed to dial back on the sugar. And I enrolled her in a yoga class so that she could get moving and start doing something to really positively manage her stress levels. So for those of you who still have your mom with you and you are involved in her caregiving, please know not just your number, but your mom's number as well, your aunt's number, your sister's number. know your numbers. This is very, very important. Higher fasting glucose levels are also associated with a greater incidence of hot flashes. So if you are experiencing those, dialing in your nutrition and your stress levels could be very helpful in helping you reduce the severity and the incidence, actually, of those flashes. And I just wanted to share that quote there from Dr. Mark Hyman, that the single most important thing you can do to prevent and reverse disease and extend your health span is to keep your blood sugar in balance. Those are really very, very true words. So basically, if there is just like one takeaway from today, one thing that you keep in your mind is know your fasting glucose level, know your HbA1c. That is super, super critical. As we age, our thyroid function also decreases. That TSH there, thyroid stimulating hormone. That speaks to your thyroid. And this can impact our ability to lose weight. It can impact our ability to regulate our body's temperature. It can impact our skin, our immunity, and it can also impact our cholesterol levels too. I often look at thyroid function and cholesterol levels together, and I think there was a question that was submitted together with somebody's registration about some of the reasons behind high LDL cholesterol and what can we do about this. There is a genetic component, but if your LDL is increasing, your LDL cholesterol being your bad cholesterol, if that is increasing as you age to, worrisome levels, I would have a look at where your fasting blood sugar is at and your HbA1c. Is it high? If so, then we have to do something about it. I'd also have a look at TSH. What is your thyroid doing? Does it need support? Is it getting sluggish? Because when it does get sluggish, the ability to clear cholesterol is lower. And so that leads to increased cholesterol. And the other thing I like to have a look at, and if you are a reader of my newsletters and you've been working with me, is, what is happening with your digestive health? Are you pooping? Are you getting enough fiber? Most women do not. We think that if we have like one daily bowel movement, that it's more than enough, but it's not just about the quantity of your bowel movements, it's about the quality. Is your poo trapping enough toxicity and stuff that we don't need? If your LDL is increasing, then maybe your poop needs some quality control, okay? I also want to share with you there that we often see an increase in uric acid levels during perimenopause. Now, this is something that we normally associate with men, but perimenopause can increase the level of uric acid in the body and therefore your increased risk of gout. Estrogen protects women from high levels of uric acid because it helps us flush it out. But as our estrogen levels decline, our uric acid levels may rise, and so too does our level of inflammation. It's not uncommon to see high levels of uric acid together with high levels of C-reactive protein, that CRP level there as a marker of inflammation. And this pattern is common even in women who do not have symptoms of high uric acid. When I see this pattern, then I often look at perhaps decreasing the amount of red meat in a person's diet and seeing what we can do with the diet to lower the acidity in the body, especially if they're looking to lose weight. I wanted to share this information with you because a lot of women during perimenopause report saying that they don't understand what's going on with their body. And there's so much sadness and shame attached to this time in our life. And the thing is, a lot of what is happening to us is happening behind the scenes. So if you can relate to this feeling of being out of touch with your body and not understanding what is happening to you, or if you feel like you're trying to take steps and nothing you're doing is working, then maybe you need some fresh data. So starting with a visit to your doctor and running a metabolic panel can be really, really helpful for you. Okay. Now, getting your blood markers tested every year is all well and good, but generally, if they're all within lab range, you get a call from the secretary, not even from the doctor, saying like, all good, nothing to see here, no need to follow up, right? But what if, despite everything being within lab range, you're not feeling that great? This is when understanding optimal ranges is really important. Optimal ranges are basically, they are evidence-based ranges that are associated with the lowest risk of disease and mortality. A reference range, or the lab range that you get in your report, indicates the range of typical results that are found in the entire population the lab serves, okay? And it does not necessarily indicate an optimal range for health, okay? They're the results found in the entire population. So just because your labs are within range, it doesn't mean that you're actually practicing preventative healthcare. And more importantly, it doesn't mean that the symptoms that you are experiencing have nothing to do with your results, okay? If your thyroid stimulating hormone, if your TSH is rising year on year, as is the case with many perimenopausal women, and you are chronically tired, your hair is falling out more and more, your skin is super dry, your sex drive is low, your cholesterol levels are rising, then okay, maybe you are within lab range, you're maybe within the reference ranges, and maybe this is not a case for medication, but your thyroid is expressing stress through its gradual increase of TSH levels. And we should probably pay attention and take care to support you and your thyroid as part of a holistic protocol for your health. If your fasting glucose is rising year on year, like it does for many perimenopausal women with high stress profiles, then you may not be pre-diabetic, but this is definitely an issue that you need to address, especially if you also have other symptoms like high blood pressure, for example, or if you have anxiety or sleep issues. One of the first things that my clients, when working with me, report is an improvement in their sleep, no more 3 a.m. night wakings. And that has a lot to do with regulating blood sugar. Moreover, many people are like, what does blood sugar have to do with anxiety levels? And the reality is that if our glucose is spiking because our diet is not right for us, or because we are continuously in fight or flight, and our stress levels are super high, our body is going to have a really tough time coping with those super spikes and mega crashes in our blood sugar. And so we are more exposed to feeling things like hangry and feeling like we are not in control of our emotional response to stress. And so we often go through life feeling like we can't take one more thing. So I wanted to give you the optimal and functional ranges for these key markers on this panel. All of the markers that you got in the previous slide, they all have optimal ranges, but these ones here, these are the ones that in my experience are most often outside optimal range in the perimenopausal woman. And when these are outside optimal range, then it is very likely that you are going to be in a situation where you're going to say, I went to the doctor and they said my blood work was fine, but I don't feel fine. So please make note of these ranges, if not today, then when you get the recording, or take a picture of the slide. And just as an aside, I have very rarely seen in my years as a nutritionist and helping people with their metabolic health, I have rarely seen a fasting glucose or an HbA1c level within optimal range. And just going back to the story about my mom and her HbA1c level being 5.6, I actually asked her doctor, what are your thoughts on this level? And the doctor said, I never see levels below 5.5, so this is great. And so the problem really though is that, our cardiovascular, the rates of cardiovascular disease and Alzheimer's keep on climbing every year. And so, I would say that especially, with respect to fasting glucose and HbA1c levels, if you're not within optimal, it's not fine. And it's not just a nutritionist who's saying that, it's a lot of very well respected doctors and functional medicine practitioners like Dr. Hyman, like Dr. Mosconi, and many, many other longevity experts. So do please make note of that. Okay. So I just want to actually use that information on optimal levels to reinforce the message of how aiming for optimal can really, really change your health. And notice I didn't say reaching optimal because I really don't think that we need to let perfect be the enemy of good here. But I mean, just making intentional choices on a daily basis, taking one step forwards towards optimal every day. So I want to share with you the case study here of a female client of mine who came to me with the feedback of, I went to the doctor and she says I'm fine, but I am not fine. She went to go get her blood work results and, got the typical call from the secretary to say that her blood work was fine, no follow-up required, nothing to see here, but she still felt like crap. She was 47 years old, chronically fatigued with a very high inflammatory profile. She hadn't slept well in over a decade. She'd been diagnosed with arthritis, and so was having a lot of joint pain. She reported high levels of anxiety. Ovulations and periods were still regular at her age, but very, very painful. Periods being extremely heavy. And the only solution that she was getting from her healthcare practitioners on that was, well, you can go on the birth control pill again, even though you're not interested in birth control anymore, or you can take extra strength Advil. So here's the thing. Whilst all her markers might have been within range, there are still clues there as to how her inflammatory symptoms piece together and why she was suffering from the symptoms that she was suffering from. Given her trouble losing weight, as well as her low energy levels, and she also said that her hands and her feet were always cold and things like that, I wanted to see where her iron, where her ferritin levels were at. And we see here that the lab range for ferritin is 5 to 272. And she's at 5. Okay, so basically, yeah, like she's technically inside the lab range, but she has next to no available iron stores to help her body create energy. So is it any surprise that she is fatigued? No. We also see that her HbA1c, which is her average blood sugar for the last 3 months, is at 5.7. Doctors never flag blood sugar unless it's over 6. But if you see that your HbA1c level is over 5%, please book a consult with me. Maybe it's nothing to worry about, but in this client's case, her C-reactive protein, which is a marker of cardiovascular inflammation, is at 2.5. That's the number there on the bottom. And functional medicine experts advise that optimally CRP levels should be below 1. So now I know that this client is dealing with an inflammatory load and that managing her blood sugar and ensuring that she has adequate iron sources in her diet is going to be really, really important. But what other clues do we have here? Plenty, plenty more. Her doctor never diagnosed her with hypothyroidism, and it's true that her TSH is just outside of optimal levels. Okay, it's a 2.36. And usually if you're, below 2, then you're okay. But we know that her ferritin stores are very low, and that this could be compromising her production of her active thyroid hormone called T3. So we had a discussion, and my recommendation to this client was that she go back to her doctor and advocate for a full thyroid panel that goes beyond TSH to understand if there is something else at play here. And when we are looking for at thyroid function, I also like to couple that with cholesterol. In this client's case, her cholesterol levels are fine, but one of the most meaningful markers for heart disease is your total cholesterol to HDL ratio. And the cardio experts are saying that it's even more relevant than just, what your plain LDL and triglyceride markers are at. Your ratio should be under 3. Okay, in this client's case, it's at 3.2. Generally, when the thyroid isn't working well, your metabolism slows down, so you have a hard time clearing your LDL cholesterol. And you also have trouble losing weight. But with her CRP levels at 2.5, this tells me that we don't want that ratio to go up anymore, right? And if we really want to help this client, lose weight, if we want her to relieve her symptoms, she needs a nutritional plan that is going to support all of these issues, which are suboptimal. And in that way, we can help her reach her goals, but we can also help her lower her inflammation profile and ward off cardiovascular, the risk of future cardiovascular disease. This client ended up doing a program with me called Metabolic Balance, and within 1 month, the data collected from her Apple Watch was showing us that her deep regenerative sleep was much longer at night than it used to be. And within 3 to 4 months, she stopped needing Advil or taking Advil for her ovulation and her period pain. She lost 15 pounds, and she reported fewer episodes of anxiety, and her joint pain also disappeared. So that is a really, really amazing result that we can do with a program that's really measured to you, personalized to you. And sometimes weight loss is a part of that journey. And let me see, there we go. Sometimes weight loss is a part of that overall journey towards greater metabolic health. And when we go through perimenopause, one of the many things that women notice is that they have a tendency to accumulate weight around the midsection. There are many reasons for this, but our decline in estrogen, high stress levels, and rising blood sugar are all key factors in this. Once we hit perimenopause, our body actually wants to hang on to belly fat, unfortunately, because our body uses it to make estrone, our backup hormone for estrogen. So it's not all our fault, ladies. Our body is kind of working against us behind the scenes. However, another marker outside of your blood work that we should all keep track of is our waist measurement. Once our waist goes over 35, our inflammation levels are very likely to go up, and that's going to make all of our perimenopausal and health symptoms worse. It's also very useful as a woman to combine your waist measurement with your height and do a height to waist ratio. If it is over, I'd say 0.5, then again, reducing that visceral fat around your waist could be extremely beneficial in protecting your overall health and improving any mind-body symptoms that are currently disrupting your life and keeping you from thriving. I've noted the number for men too, because I know we all like to take care of the men in our life. So please do feel free to pass that information on to the men in your life as well. And there, like on the left, as you can see, working with a personalized nutrition plan that's based on your blood markers, like the metabolic balance plan, can really help with that visceral fat loss journey. And just in closing, I just want to say that the funny thing is that as a nutritionist, I do have a lot of clients who come to me because they want to lose weight. That's kind of like the pain point that gets them in through the door. But by our last session together, the furthest thing from their mind is the weight that they've lost. They are just grateful for the fact that they don't have any more joint pain and that they were able to walk 10,000 steps during their holiday to like Italy or whatever. They are grateful for the fact that they can sleep more deeply and wake up more refreshed, that they have more energy, and they're grateful because I think that somehow opens up more room in our life for joy and connection. And we're all looking for a bit of that, I think. So, yeah, I just like to end by saying that I really believe that optimal metabolic health is such a key role in our health throughout our lifetime. And knowing your data is so, so important. If you would like to consult with me regarding your particular symptoms and how a personalized nutrition plan can help you, please do reach out. I do offer free 15-minute one-to-ones to talk about, what your goals are and if I'm the right person to help you. The list of blood markers that I showed you, if you live in Ontario, you can go to your family doctor and ask for such a requisition, and it's free. It's the beauty of our healthcare system. If you'd like to do that and then come to me, I do help clients go through the results and detail a list of follow-up questions for your doctors so you can have a better conversation with them and advocate for your own health accordingly. And I can help you with a personalized nutrition plan if that's what you're looking for as well. Yeah, we really are the only ones with a vested interest in taking care of ourselves. So I really do hope that this information has helped you understand your transition through perimenopause and menopause a lot better, and how we can use nutrition to take care of ourselves. Nutrition really is one pillar, and caring for our mental health is another. So I'm just going to pass it on to Barbara now so that she can share with us her wisdom, and after that we can open it up to questions.
Thank you very much, Christina. I'm just like ready to run out to my doctors right now and be like, give me these results. I want to know. So thank you. Piece I'm going to add tonight, and we will speak more about it. There is a follow-up workshop happening on October 26th. It is also free, and we'll be on Zoom, and it will be talking more about the mental health components around perimenopause and menopausal experience, and kind of creating a round table, kitchen table conversation as women. So if that's something you want to do, participate in as well, I will just, oops, I'm looking for the right link to send to you so you can register. It is a separate registration from tonight. But from a mental health perspective, one of the things out of my experience clinically is that many women talk about, my doctor didn't know anything, I started to feel a bit crazy, my anxiety was off the deep end, I've never been depressed in my entire life, and I can hardly get my knuckles up off the ground. And a kind of element of surprise and inadequate response around their mental health needs. And this is sadly something I hear pretty frequently, because both in our kind of cultural norms as women and as a society, we don't talk a lot about mental health, let alone in relation to hormonal changes as women. And two, because it really isn't a significant part of the medical training. And there is limited research around those very clear links of perimenopause and mental health. So I want to just encapsulate a little bit of information, what we do know. When we think about mental health symptoms around perimenopause and menopause, we're going to think pre-menopausal, perimenopausal, then menopausal, and after. And what we know in perimenopause, you're starting to be a little bit funky maybe around your period, is about 4 in 10 women are going to have some form of mood symptoms, low-level mood symptoms that are very similar to PMS, premenstrual syndrome symptoms, irritability, low energy, feeling kind of tearful or moody, difficulty concentrating, those kinds of things. Except for they don't just happen related to what is your usual monthly cycle. So those can be popping up at any time. So there's a hunk of women who are just going to have essentially what we consider PMS symptoms with some regularity through this time. And they're exhausting, right, to live in. Then there's going to be some folks who are going to notice a significant increase around anxiety. This is typically in lead up in perimenopause versus after menopause. And women who have no history of mental health needs or no history of anxiety will describe having very significant panic attacks or a kind of physiological agitation that they have a difficult time calming. And there is less research around the link between anxiety and perimenopause than there is compared to depression. There is a very clear link between perimenopause and menopausal periods of our lives with depression. So about 18% of women in early perimenopause and about 38% of women in later perimenopause are going to have significant symptoms of depression. Those numbers are pretty darn high. The reality is the incidence of depression can double and up to 65% risk increase in mood dysregulation. And this is for both women who have a history of mental health needs and for those who have no experience previously. So we talk a bit about for those folks who had an earlier diagnosis of anxiety or depression, you have about a 3 times higher risk of having a recurrence of a major depressive episode during perimenopause compared to premenopause and compared to postmenopause. So the perimenopausal time is a very vulnerable time with all the changes that are going on physiologically in our body. If you have some experience around having depression and then you're in perimenopause and you're a little feeling funky and things are a bit weird, one of the things that happens is that the depression symptoms may show up differently. So what you have known as your typical depression symptoms and what become your depression symptoms during perimenopause could be quite different and could be quite fluctuating. And so it results in a lot of women not getting adequately diagnosed or treated for their mental health needs around this time. So it's worth just being taking seriously the information your body and your mind is giving you to be like, this doesn't feel quite right. It doesn't feel like it used to, but it doesn't feel quite right. I don't feel quite right. And I would say I personally have a history of depression, and I am not an anxious person in general, but during perimenopause, I literally could not calm my body. I felt like I was on fire, but not hot, but like a buzzing through my whole system that was just unbearable. And it was quite shocking because of that. I kind of knew what I was getting into when it came to depression for me, but this was like a whole different kettle of fish. So being prepared to watch how is it presenting now, being able to talk with your provider about that is really important. The good news about all of this, because those stats are a little bit scary, I think if we all got to see Cristina, our stats would be much better. Because I do think there are lots of ways in which we can help our bodies that then help our mental health needs. But what we do know is that most women with perimenopausal depression and anxiety actually respond very well to treatment, whether that's counseling or medication, a combination of those two things, or the sort of holistic approach that looks at the body markers, the blood markers that Christina's been talking about tonight, and we target reducing inflammation, we target increasing sleep, shifting fatigue and iron levels, all of those kinds of things. So stay hopeful. It's not all lost, but it does mean we really need to open up our conversation more effectively about it. So I want to invite you to come October 26th to our next conversation. It's called Crosstalk, and it's going to be women. There's going to be a few women who are going to share personally from their experience, and I will do a little bit more talking about what this looks like statistically and clinically, and some things we can do to tend our mental health during this time. And then we're just going to hear from wiser women who have figured this stuff out.
Beautiful. Well, I'm just going to stop sharing my screen, and I'm going to open it up to questions now. I'm going to stop the recording so that you can feel free to ask questions and know that they're not being recorded. So